are many medical challenges LGBTQ+ patients face, especially for fertility care. Surveys show on top of the high cost to build a family and navigating insurance, many have negative experiences with healthcare providers.
CBS 8's Abby Black explains the need for better fertility care for a growing population among the LGBTQ community.
When people find out that I carried my child, they're astonished.
Andy Hosh says that he was just as surprised to birth a son who's now 3 years old.
I remember the doctor asking me, "Are you sure you don't want kids?" And at 19, I wasn't thinking about kids. I was 19, I was in college, I was just trying to be who I am.
Hosh says that he was more concerned about feeling comfortable in his own skin than being told by a doctor at his college health center that the risk of taking testosterone would make him infertile.
It was more important for me at the time that I was comfortable with the voice that I heard, that I was presenting how I envisioned myself.
But 4 years later, as a trans man, Andy wanted to be a dad, but he says all those misconceptions and even his own transphobia flooded his thoughts.
You need to freeze your eggs before you start transitioning. Anything that testosterone would do would change the chemistry of your reproductive organs. Being pregnant and having a kid would make me less of a man.
He says after seeing other trans fathers carry children, he found an OB/GYN at UCSD who treated trans patients and was confident that Andy could conceive a child.
She just made it so comfortable for me to be in that space that is traditionally a very feminine space.
But to prepare his body for pregnancy, Andy would have to stop taking testosterone, and he says the gender dysphoria resurfaced.
Like my voice, it went up like an octave.
But before he got pregnant via at-home insemination with his baby's father, Andy had top surgery. And while some trans men do, Andy says he had no intention of chest feeding.
My chest started producing a little bit of milk, and that was really uncomfortable. Things like that was way outside of my comfort zone. That would have been a reason for me to not have had a kid, that one piece.
This is where doctors play a key role in advocating and treating trans patients for fertility.
But here at UC San Diego Health, they've been nationally recognized as a leader in providing LGBTQ healthcare equality.
I think that there's growing recognition that in the trans population, so many individuals want to grow their families.
Dr. Irene Sue works with Andy's doctor. She's the professor of OB/GYN and reproductive sciences at UC San Diego. She says many of the trans patients that she treats face physical, mental, and financial burdens. In vitro fertilization, egg or sperm donation, surrogacy, and adoption can cost $200,000. Those factors make it even more daunting for trans patients seeking insurance coverage.
Our codes for these procedures, like egg freezing, it's related to a female patient, not to a male patient. And so sometimes you have automatic denials of pre-authorization.
Dr. Sue says California was one of the first states to pass a law in 2019 mandating insurance companies offer coverage for fertility preservation, but not IVF. Yet many of our LGBTQ patients are being denied, which is leaving them with a lack of care and pushing providers to be more aware.
And I think that the work that has to be done isn't simply advocating for these laws, but understanding where, like, you follow that law through these multiple systems, understand where the barriers are so we can maybe have better laws.
With the support of doctors, Andy says that he was able to navigate many of these barriers, but he still struggled knowing that his son would have two dads.
Is he going to be resentful of me because he doesn't have a mom? And I took him to Pride a couple years ago, and he took a trans flag and was waving it, and it was like in that moment, it's like he is proud of who I am just like I'm proud of who I am.
That pride took some time to build, but Andy says today he would tell his 19-year-old self and other hopeful trans parents, despite all of those barriers, to never give up.
It was one of those things that while it was happening, I was like, oh my God, is this ever gonna end? And then it did. And now I have a beautiful child and a very fulfilling life that I live as a man.
Abby Black, CBS 8.